to EMHC channel. I am Dr. Brandon Shern, a licensed clinical professional counselor in the state of Maryland, as well as a nationally certified counselor. I want to thank you for taking the time to view this video. Like, subscribe, and all of that stuff. Please follow me on social media so you can get this content as I'm producing it. And hopefully you find this helpful, because what we're going to do today is cover the 5 things you need to know about trauma. Now, when I say 5 things that you need to know about trauma, I'm not saying that there are not more things to know. What I am saying is that these 5 things, if you can understand it, if you take it and you apply it, then when you yourself experience trauma, or someone that you knows have experienced trauma, there is a greater sense of, right? And especially if you happen to experience the same situation. Okay, so we'll get into that a little bit later. But really, I just want to begin to demystify and disrupt the way that we speak about trauma and traumatic experiences. All right. So the first thing to understand is that trauma is an emotional response following experiencing a distressing event. I want to break that down. Trauma is not the response. You don't have trauma. You experience traumatic events. You experience traumatic situations. And the reason this is important is because we have to begin to speak correctly about what it is we're talking about. If we don't do that, then if you don't do that, then you talk about trauma as if it's something that we can change, right? The event, the situation cannot change. It has already happened. That you can't change. And so many times that becomes the focus, trying to undo that. You don't try to undo that. You can't. And that is like fighting a losing battle. So what you do is you recognize that I am having an emotional experience to something that I did not like. It was outside of the norm, outside of what you could normally expect to happen to you in life, such as it is. So that response is an emotional one, and it typically is on the tail end of a distressing event. The problem is sometimes we don't really pay attention to the events, and we kind of bury our emotions. And so, just like weeds in the ground, if you put a tarp over the weed will find a way to get out. I don't care how much tarp you put in it. So there is a process to getting rid of the weeds. It takes a little more work, um, but that process will reduce the amount and the effect, or the prevalence of the weeds, specifically if you garden, right? So if you garden, or if you do anything with landscaping, I'm sure you can appreciate that analogy right there. The second thing I want you to know is that your response to the experience often determines the severity. Now, this might sound a little bit weird. Like, how is it that my response to the situation determines the severity? And it's quite simple. You cannot control how life happens to you. This is a maxim of mine. You cannot control how life happens to you, but you can control how you happen to life, right? So, in place of life, you can insert circumstances, situations, events, right? All of the things that we're talking about. You can't control that, but many people do try to, and we extend a lot of energy trying to control situations, trying to control things outside of us. And that is exhausting. And we get frustrated because the world or people are not bending or flexing to what we want them to do. Right now, no one wants to be the victim or target of anything traumatic. But again, you cannot control how life happens to you. You can control how you happen to life. So your response to the situation determines the severity of the intensity of the emotional response. All right. So remember, your response is an emotional one to the event that is deemed traumatic. Okay. Number three, everyone experiences traumatic events differently. Now, this should go without saying, but it bears saying, because we often believe that people should respond the way that we respond, right? So I think that that's a big issue. So you should think that's a big issue. And the fact that you don't means that you are invalidating my experience. No, everyone experiences events differently. And the beauty in this is when you have something happen that it doesn't affect you as much as. Now, think about this. Remember, it's an emotional response that we're talking about. So it's a response to a traumatic event or something that's distressing. Okay. Now, what's distressing to you might not be distressing to the other person or to me, and vice versa. So by allowing me to have my own response to an event, you then are allowed to have your own response to an event and not have this experience or sense that you are supposed to respond the way you think I want you to respond. Right. So in this case, we don't magnify things that do not need to be magnified, and we don't minimize things that needs to be examined a little more closely. Right. Number four, not all traumatic experiences or experiences of trauma require a diagnosis. The this I need to say this, and specifically because when I work with clients and when people come in and they think that because they have experienced an event that they need to be they need to have a certain reaction, they need to have, right? So you experienced um a loss of a job, right? Something that shakes up your life is unexpected. You got laid off and you wasn't expecting it. So now, but you are not in the dumps. You're not having an emotional response like people would expect you to. And so all of a sudden, people, these are some of the things that has happened. I would be told by whoever is reaching out. So for the most part, it would be parents that have kids who've experienced some stuff. And then they will reach out to me and say, this person experienced this, but they're not talking about it. They need to talk about it. It was traumatic. It was trauma. Right. And oftentimes what I'm saying is, well, if they are not responding, you want them to respond the way that you want them to respond instead of allowing them to have a meaningful response on their own. Going back to point three, everyone experiences traumatic events differently. So, therefore, not all experiences of trauma require a diagnosis. Now, to be sure, there is a formula. There is some criteria that will be met if it and it has to be met if we're going to be given any diagnosis of trauma. And trauma in and of itself is not a diagnosis. It's a collection of diagnoses. Okay, a collection of different labels that we can give to describe what it is the person is experiencing, from reactive attachment to social disinhibited engagement, right, or disinhibited social engagement, to post-traumatic stress, to disorder, to acute stress, and complicated bereavement, and all of this stuff, right? So these are different, but it falls under the heading of trauma and stressor related disorders. Number five, stains from traumatic experiences can largely be erased. Now, this is where, sometimes I might, you know, become a little more optimistic or whatever from people who might also operate in this space. And I'm not taking anything from anyone. I'm speaking from experience. And so what I want to do is I want to show you something. I'm going to do something. And then, all right. Now you might be wondering, why on earth did this person just show us the sides of his neck? And it's a simple explanation for that. My question is, did you notice anything on my neck on either side? Okay. Now, think about that for a moment. Now, rewind it if you need to, pause it, take a step, whatever you need to do to really zoom to home in on my neck, on the sides of my neck. Now I'm going to share a secret with you. Now, these you can see, right? Because I didn't have them removed. But there was one point in time at which I had tattoos on both sides of my neck. And I share that because a lot of people talk the about trauma being tattooed, being like a tattoo. And not to say that it doesn't alter you in such a way, but the stain of the trauma can largely be erased. The emotional experience, the emotional response can largely be erased. Now, there was a point in time at which I thought it was the tattoos on my neck was impeding me and preventing me from getting a lot of into a lot of places, into a lot of spaces. Similarly, you know, if you've experienced trauma and it's impacting you to such a degree that it's influencing or negatively impacting your ability to function in life, such as the tattoos on my neck had done for me, you might seem or get to the point where you're like, oh, all is lost. Well, it actually isn't, because what I was fortunate to do or to come across was laser technology that, while painful going through the process, actually removed layers of skin on both sides of my neck, allowing the tattoo ink to come to the surface and be removed. So, largely removing the stain or the ink from my neck, which opened up doors for me, because now people no longer, now I got locks, and it covers my, it also covers my neck up a little bit, but I'm talking about when I had no hair, and I had my hair shaved low or cut low, and I was still able to function. I didn't have to wear turtlenecks to hide it or any of that stuff, because largely it was removed. And the only way that you would know that I had tattoos there is if I told you. Similarly, once you get to a point, so this is now number 5 is really about those who have experienced an event that was traumatic and it's impacted them. It's left a mark, right? They all leave marks, but this one is severe and it's impacting you negatively. You can get with someone and you can largely have the stain of that removed. Okay. Was that process painful? Yes. Did it hurt in the moment? Yes. And I'm talking about getting the tattoos removed from my neck. It was about 10 separate instances where they were just on my neck, right? Removing, I can smell the flesh burning. I could, there was pain after the fact. I had to walk around with, some gauze on my neck to cover it so that it wouldn't get infected and all of that stuff. However, fast forward, that process took about 6 months. Now, recovering and integrating traumatic experiences and re-emerging will probably take a little more than 6 months. That's dependent upon how hard you work. But if you do the work, you go through the pain, you can remove the stain largely. And the only time people will know that you have been through a traumatic experience is if you tell them that you've been through a traumatic experience. And that's different than having the experience show up at unexpected times without you actually being able to navigate or manage how it shows up and when it shows up, the effects of it, so to speak. Much like my tattoos, I couldn't cover them because I didn't have any hair at the time. And so people just readily saw it. I was walking around with the scars. And then once I went through the process of getting it removed, the only time people know now is if I tell them. So hopefully this short video has helped you understand a little bit more about trauma and traumatic experiences, as well as the emotional reaction to it. um, like, subscribe, share this video. Really just want to get out here and kind of disrupt the way that we talk about trauma in that sense, and traumatic events and experiences. And it's all about empowering you to live your life at the fulfillment and in the best way possible, right? So you can fulfill your potential, but you cannot do it if you are negatively impacted or stunted in your growth because of things that have happened to you in the past. That is what Empower Me is about. We use holistic methods, and I look forward to seeing you around the channel. Okay. And again, um, take care, like, subscribe, share this, spread the word. There is someone out that is seeking to disrupt the way that we speak about trauma and the way that we heal from trauma. Okay. So, again, I thank you for your time. Take care.